Let's bring in once again board-certified emergency medical physician and ABC News contributor, Dr. Darien Sutton. All right, Doc, public health officials and measures already changing around the country because of this new variant. In New York City, not only was the indoor mask mandate reinstated last week, but now 5 to 11-year-olds must show proof of 1 vaccine dose starting December 14th. That's right around the corner, while everyone 12 and older must show proof of 2 doses starting December 27th. So do we know enough, you think, about this new variant to determine if these drastic measures are even necessary or effective?
Well, good afternoon, Kira. I think that we do. We understand so much information that we've gained throughout this pandemic, and we know that vaccines help reduce the risk of outbreaks. The goal of these mitigation policies is not just to reduce our risk of seeing more of the Omicron variant, but also the COVID-19 virus overall, as the Delta variant is still the primary threat within the United States. And we know how this virus works. We know that it likes indoor spaces with limited ventilation, so mask policies help to prevent that. And we also understand that vaccines, or states and localities that have higher vaccination rates have lower rates of outbreaks. So again, these policies are put in place to protect the public.
And Dr. Sutton, the news today may be Dr. Fauci's comment that it seems at this point to him that Omicron causes less severe disease, that it's more transmissible, less severe, which can happen with viruses. Last week in this country, we saw pediatric infections skyrocketing to 133,000 children testing positive. That accounted for 1/4 of all weekly cases. And in South Africa, this Omicron variant detected just a few weeks ago, it now accounts for 75% of all the cases in South Africa, but they aren't seeing increased hospitalization. So that is the question. Are we looking at a new era in COVID? And considering how much buy-in we need from the public on public health authorities and advice, maybe we should go slow on some of these measures until we really do see how serious this new variant is.
Well, Terry, I think you point out some great points. So far, we have not received any signals or red flags that this variant, Omicron variant, is proving to be more harmful. And by that, I mean, is it putting more people in the hospital and is it causing more death? We're really happy to see that. But as we have known from the past, we have to act cautiously because we just simply cannot predict the future. So far as those children aged 5 to 11, recently today, the CDC director stated that approximately 5 million have received at least 1 dose, but this only accounts for approximately 20% of that age group. And so we'll likely continue to see rates of COVID-19 increase as we try to get more vaccination in the arms of children and young adults. And as far as looking at other countries, we also understand that there are many variables that affect the rates of increase, such as vaccination status and rates in those countries, mitigation efforts, and also overall understanding of this virus and community education, as well as genomic sequencing. So I think until we have all of this data back, we have to act cautiously. And by that, using the mitigation efforts that we know work, especially in these cold winter months.
Do you think it's possible that Omicron could overtake the Delta variant? And could it be a good thing if symptoms are a lot less severe, as we've seen? We've only heard mild symptoms thus far.
We still have to wait and see for that. Right now, it is quite possible that Omicron could be a leading variant when we look at the rates of COVID-19. But what we have to be assured of is whether or not this variant is causing more harm. Luckily, for now, we have not seen that. And so far, the majority of those who are hospitalized are, again, the unvaccinated. So we're trying to encourage the public to remind them that these vaccines continue to prove effective in preventing hospitalizations and deaths. And I also remind my patients that these vaccines were produced before we knew the Delta variant existed. And unfortunately, these variants likely chip away at that immunity, but they don't get rid of it. So I really want to encourage everyone out there, if you haven't done so already, to get vaccinated.
It is good advice, especially with the more transmissible disease, because even if it's less severe, more cases may mean more severe cases. Dr. Darien Sutton, as always, thanks very much.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.